Hello and welcome to Dr. Ankur's lecture. I am Dr. Ankur Sharma and today we are going to talk about chemical mediators of inflammation. This is a part of case vignette number 1 on a case of mandibular fracture. In an earlier lecture, we studied about cellular and vascular events of inflammation as well as about types of chemical mediators and where they can act. Now we will study further about these chemical mediators. An important thing that we want to know about them is that where they originate or where they're formed. So there are broadly two important places where these mediators or the precursors are synthesized. First is inflammatory cells and second is liver. In cells, mediators may be pre-stored or synthesized in new as and when needed. Those stored in cells are histamine and lysosomal enzymes, whereas those synthesized in novo may be various like leukotrienes, oxygen species, prostaglandin, etc., whereas synthesized by liver are precursors of kinin, coagulation, and complement system. Now, coming to what these mediators do, these mediators are responsible for 5 cardinal signs of inflammation, that is rubor or redness, tumor or swelling, chelo or increase in temperature, dolor or pain, and functionaliza, loss of function. Rubor is caused by vasodilatation, that is caused by prostaglandins, histamine, etc., whereas tumor is caused by increased vascular permeability and chemotaxis and leukocyte activation. Former is caused by histamine, bradykinin, leukotriene, PAF, substance P, etc., whereas latter is caused by C5a, leukotrienes, etc. Chelo is caused by interleukin, tumor necrosis factor, and prostaglandins. Dolor is caused by prostaglandins and bradykinin, while functionaliza is caused due to tissue damage by lysosomal enzyme, oxygen species, and nitric oxide. Now, what these mediators do and their sources in a summary. Histamine and serotonin are formed at mast cells and platelets and cause vascular leakage, while bradykinin is formed by a plasma substrate and causes vascular leakage and pain. C3a and C5a are synthesized by plasma proteins in liver and macrophages respectively. Both of them cause vascular leakage, but C5a additionally also causes chemotaxis. C3a causes opsonic fragmentation and formation of C3b, and C5a causes leukocyte addition. Prostaglandins potentiate other mediators and also cause vasodilatation, pain, and fever, while leukotrienes are synthesized by leukocytes in mast cells, whereas B4 causes chemotaxis, C4, D4, and E4 causes vascular leakage, bronchoconstriction, and vasoconstriction. Platelet activating factor is synthesized by leukocytes in mast cells. In addition to vascular leakage and chemotaxis, it causes bronchoconstriction. Interleukin and tumor necrosis factor cause acute phase reactions and endothelial activation, while chemokines cause leukocyte activation and are formed by leukocytes and other mediators. Now, that was about the chemical mediators of inflammation. I hope this lecture was useful for you. If you liked this lecture, kindly like, share, and follow us on YouTube on this link or on Facebook. You can also visit us at www.dentallectures.net. Next lecture will be on pharmacological drugs used in inflammation and pain. So, till our next lecture, keep waiting.